You know, I was drawn into psychiatry and public health. Got the public health merit badge when I was a Boy Scout in Jonesboro, Arkansas. And that was interesting and scientific behind it and fascinating.
I think Rick's impact on public health in Arkansas is immeasurable.
He's not just a nice guy, but he's a knowledgeable guy. And he has a way of seeing the forest from about 30,000 feet.
He's the kind of professional physician that works behind the scenes. He doesn't need the glory, and he's willing to put in the hard work, but he has literally changed the landscape of Arkansas.
It's like this is his hobby, this is his extracurricular activity, is public health. And it's a beautiful thing to watch and a fascinating number of people that have surrounded him.
It was just a lot of energy, and it was all dedicated to health and the state of Arkansas.
There's no doubt that from a public health perspective, he's made so much difference because, you know, he kind of lives the UAMS mission. Our mission is to improve health and health care throughout our state. That's his DNA.
You know, I've watched Rick as the College of Medicine Dean now twice, as the head of the Psychiatric Research Institute, the head of the Psychiatry Department, the head of a Mental Health Services Research Center, and the head of the Arkansas Center for Health Improvement. You know, I think he is at his base a committed citizen of Arkansas. He uses the tools of health services research, advocacy, leadership to make a difference, and he instills those characteristics in others around him, encouraging them to move forward in step and quickly.
He's got all sorts of balls in the air, and I never saw one come crashing down. I saw some close, but I saw him pick it up real quick.
The Psychiatric Research Institute that Rick opened, we hospitalized, took care of about 1,500 patients a year. We were busy, and at times it felt like we were building an airplane like as we were flying.
Dr. Smith is such a visionary, and he had the vision for education, for research, and for clinical care, all at the same time. And one thing I love about Dr. Smith is he brought others along, and he has really worked hard to move the needle in psychiatry.
We got the idea to do this, and if you stay at it long enough and you're fortunate enough to live long enough, you can usually get something like that done.
One day we were visiting and I said, you know, every time I talk to you, I feel like you're diagnosing me. And he said, I did that the first day we met. You're an easy diagnosis. Now I've been treating you since then. So.
He's very persuasive, and he could persuade people to do things, and he would help them. It's not like he just, you know, threw them overboard to swim.
If he wants to recruit you, beware. He is very, very good at recruitment.
Dr. Smith, along with other visionary leaders, Joe Bates, Tom Bruce, and many others, had tried to get a College of Public Health started unsuccessfully. The consolation prize was the initiation of the Arkansas Center for Health Improvement. Kate Stewart, Suzanne McCarthy, Rick had started that, and I was in DC. Rick came up and said, it's time for you to come home and help us.
Yeah, I talked Joe Thompson into coming back to Little Rock, and I remember sitting in Washington, D.C. in a restaurant several times and saying, you know, we need you back here.
When he goes after something, he goes after it.
Rick set the Arkansas Center for Health Improvement up to take risks that the sponsoring organizations would not take. And occasionally he got nervous with some of the risks that we were pushing out in front. But he never said stop. He always said, if it's the right thing, if it's going to make a difference, if we can have an impact, let's go for it. And the Arkansas Center for Health Improvement has that imprint to this day.
He was very involved in the tobacco settlement. I think the vision that he and probably others shared was that those settlement dollars really needed to be invested in health and well-being.
We were working hard. It took 2 years to sell the program to the legislature.
I bet we took 30 or 40 bus trips around the state to convince people in various towns that this is a good idea for them and it's important to their community.
He sees the big picture. And I think the tobacco settlement was something he saw as an opportunity to really impact the general health of Arkansans.
You know, it's really fun to be married to a man that is that talented and that loves what he does.
I mean, look how many times he's been called back to UAMS.
You know, he keeps retiring, coming back, retiring, coming back.
I mean, I keep thinking, retire.
He came right off the bench to come back in and help the institution that he loves and the state that he loves. And I don't understand why anybody wants that job, much less want it twice.
He's given his life to UAMS.
He has a North Star that is always going to make a difference for everyone, not just those that are immediately around him, but those that he'll never see and will never know.
I've been very thankful for all the people that I've been able to work with, not just mentors, but colleagues and peers and people that have I've talked into doing things. It's been great.
He's somebody who may retire from getting a paycheck, but he's never going to retire from making our state better.
Rick, in the 26th year of ACI's existence, and on behalf of the Arkansas Center for Health Improvement's Health Policy Board, I want to congratulate you on being the 2024 winner of the Dr. Tom Bruce Arkansas Health Impact Award.